Good afternoon, everyone. Just going to wait a minute for people to get into the Zoom room here, and then we'll get started. Okay, my name is Craig Douglas. I am here to support Patrick for the AESCO Provider Roundtable. Boy, that's a lot of acronyms. So thank you all for joining us this afternoon. Just a couple of quick housekeeping notes. We are recording today's session, so if you get interrupted for any reason or you have to jump off, just send a message to information@provideralliance.org, and we'll make sure we provide a link to the recorded session. We will be posting some material throughout the discussion today, so keep an eye on the chat for any files or any updates that come in. And again, if you have any questions throughout the session today, we encourage people to use the chat function and the Q&A function that is in Zoom, and we'll be monitoring that for updates. And with that, I'll turn it over to Patrick.
Thank you, Craig. Welcome, everybody. I think you were absolutely right, Craig, about the acronyms. I think we probably need to stop doing that. That's always a valid criticism. So first of all, I'd like to begin by welcoming and thanking Marion Tresky from Allegheny County for being here with us today. Marion is going to cover some things around the HRST and some discussions we have had recently, and I am sure will be readily available to weigh in on a number of our agenda topics today. So thanks, Marion, for joining us. Before we get into some things on the HRST portion of the agenda, I just wanted to cover a few basic announcements. So there's a few things that we have received questions on, and just some alerts that we want to make you aware of from recent ODP announcements. So first of all, the ODP waivers that were to become effective July 1, ODP's announcement 076 indicated that there was a 90-day extension for the implementation of those waivers. So to the extent you have questions today about anything that was planned to be in effect, but is technically not in effect until those waivers are approved, we just wanted to call that out. There's also the recent announcement 22-067 from ODP on gross adjustments and retroactive payments. So we'll try to get these posted into the chat. It looks like Craig is keeping up with that. So if you want to reference the actual ODP communication, you can take a look at these things. The application and use of ARPA funds, and we just wanted to make everybody aware that there was an extension provided to the training, credentialing, and business associate programs ARPA money. This is money that is basically a minimum of $100,000 up to 1% of your qualifying ODP revenue for either 1920 or fiscal year 2021. So good to hear that was extended to October 31. So you still have an opportunity to apply for those funds. We've brought out the National Alliance of Direct Support Professionals a couple of times. We've heard a lot of interest in TPA members perhaps pursuing a credentialing program. If that does materialize into something that a lot of members are doing, we've also asked members if that's something they would like to do collaboratively through the HR work group or just in general, to sort of see if that's something that we want to adopt as a project through TPA. So we'll continue to keep you updated there as well. I will say we had one question about a limitation on the ARPA funds. ODP has come back and sort of said, as a general rule, if you're going to claim $100,000, they would expect that you would be training at least 20 DSPs. So they're kind of applying a benchmark in their evaluation process. Of course, ODP can use whatever discretion they deem appropriate when they look at your proposals. But I would suggest if you hear back on something that is not part of the announcement or stated policy to date, if you would let us know. I would also suggest looking at how broadly you might be able to expand some things. If you left some things out of your proposal, then maybe you could add back in, but there is still time before the deadline to apply. So if you did get a response back that your proposal was not approved in full, you may want to take a second look at that. And of course, we would appreciate knowing anything that you're hearing in response that we may have previously been unaware of from the ODP communications. The needs exception allowance rate letters, we just wanted to sort of put that on because we know there was some controversy in terms of providers receiving those letters. Our information was that they had been distributed by the administrative entities. I think that that has been resolved, but if you are finding that you still have an issue with that question, have not received your letters, or you have concerns in the aftermath about the content and the issuance of the letters, let us know and we can have a discussion about that also. The NCI Staff Stability Survey, this was something that ODP announced in February. Apparently it went directly to provider organizations, and from conversations I've had, a lot of members were not aware they had received the survey. It seemed to have been very underreported across the state. So these were conversations we had with ODP, and we were pleased to see that NCI did in fact extend the deadline to submit the surveys. So it's already getting late in the month. They've only extended it to July 31. Probably a little less related for this discussion. There's also an NADSP, University of Minnesota study that is a DSP study that we also like to promote because they will also do a Pennsylvania profile from their national survey as well. So we're considering whether we might develop a workshop to kind of look at those surveys, promote the completion of those surveys, see if we can extract some recent information on what members are doing in terms of compensation. So stay tuned for that. If we do it, it would have to be pretty soon because of the deadlines that are impending. I think both of those surveys are due now July 31st. So just to be aware of that, if you're aware of the survey and haven't done it yet, it is out there still. You can still submit both of them, and the due dates are July 31st. So with that, before we get into the health risk screening tool, I just want to say that we've captured a couple of key agenda items that we've heard from members about, but we want to encourage everybody that this is an open forum, and to the extent you have comments about anything we've talked about in these updates so far, or there's just some things that you think are a good opportunity to try to have a discussion and resolve perhaps some conflict or inconsistency that you're seeing in application, you know, this is a forum intended to do just that. So please, I encourage you to speak up. We can open your mic. We can have you join the panel. To whatever extent that you want to participate, we welcome that. And with that, I would like to turn it over to Marion, and I'll advance the slide, Marion, but you can, actually, I'm sorry to say this, but I had added this slide that was just about the additional guidance since the questions we got on gross adjustment. So some people seem to not have gotten theirs. By a week later, everything seemed to have shaken out. So I did want to call out that according to Rick, and this is in the announcement I referenced earlier, you can check if you feel that your amount is not right. You can reconcile that to the promised download. There were some questions, and it doesn't affect everybody we know, but agency with choice was effective March 1. So there was no retroactivity, no retroactive payments or gross adjustments were processed on that service code. And as far as base funding, from the very outset, ODP had communicated that base funds would not be included in the mass gross adjustment that they would be doing on retroactive rates. So our understanding is that each administrative entity is processing base funding retroactive payments. And I'm not clear exactly how that's happening. If you're out there and you know the answer to that, feel free to weigh in. And we would hope it's rather consistent across the board. So thank you. Pardon my interruption, Marion, and health risk screening tool as it appears on our agenda. And welcome, Marion. I'll turn it over to you for some opening comments and any information you'd like to share.
Thanks, Patrick. So I will just comment on your previous slide quickly that Allegheny County did issue the adjustment payments for January, February for base funding. If there were any concerns with that, please let me know. It was somewhat of an already easy process to develop on our end because the county had done it previously for a change in early intervention rates. We just accounted for everything that was billed to us during January and February through the base program. We reiterated that through reports back to providers and identified the adjustment that the payment that then was coming their way. So if there's any concerns with that, please definitely let us know, but we haven't heard any concerns today. So the health risk screening tool, Patrick and I had chatted on Monday in preparation for this meeting. I would just say that we are also trying to develop on our end ways to integrate the HRST into our risk protocols, definitely into our individual support planning. And, you know, what we always try to do is come approached this, something new like this being implemented from a quality and risk management standpoint and a development standpoint. So we know that providers have diligently started the HRST process, have that information available to us. We certainly have been looking at it in relationship to individual situations that are happening. It is to be considered in ISP planning, obviously. I will say that previous lessons learned, at least from our AE, when things roll out, for example, when the SIS rolled out and it was a requirement to review that during ISP meetings. It took a while for all of us to get comfortable doing that and to start integrating that into the ISP. Any new information like this can be a lot of work. It can be a workload difference, but then as it becomes a little bit more known to all of us and how it might be useful, I think that just takes a little while to evolve. So I can't really tell you anything different as far as implementation, different than what the guidance that came out in 2021. I think it was January 2021, the announcement. If you don't know that announcement number, I can certainly send that through Patrick. I'm sure all residential providers would have that. So it's very specific guidance in there as to what our requirements are, our compliance requirements, I think, on all ends. And I will be very curious to see the state QA&I tool, both for providers and AEs, because we also go through the QA&I process as AEs. I'll be curious to see what, if any, indicators they have put in there related to HRST. As I said, we really are thinking about how we can integrate the results of HRST into our processes, into our risk mitigation planning, our analysis of what information is available to us from an AE perspective. It's definitely new and good information that we would not have elsewhere. Certainly, we started those conversations focusing on lessons learned from Fatal 4 conversations. One thing in particular that we had started talking about internally is how this might better inform our choking prevention initiatives. That has been a concern to us, a high concern to us for years now. We certainly have had some very negative, very bad outcomes from incidents of choking, and it's a very high risk issue. It's things we've covered before in our quarterly risk forums that Allegheny coordinates. So an example like that, I think, is one way that we would be attempting to make use of and do good work with HRST results. We are going to revisit, not that we haven't several times over the last year, how this is implemented as far as our ISP approval and oversight processes. We really hate to make it prescriptive, and we're going to try to stay away from that. But it is important to reflect this information in the planning meetings. And if that's not occurring, I think we want to be engaged in how that could be occurring. We want to talk to providers and SCs about what might make sense in that process. And we are seeing a lot of that. Just from a positive standpoint, we are seeing a lot of that in our ISPs at this point. We are seeing references to the HRST. So I'm hoping that people are utilizing that information in some way and making sure that they connect about it, especially at the provider and SC level. And I had said we did have a risk forum meeting this morning. I had said to that group quickly, although I didn't have a lot of time to get to the information that I wanted to on that call. And no, Patrick, I haven't tried to bring up anything yet. I will in just a minute. I had said to that group, I would like to work with maybe a smaller group of people who may be interested in trying to integrate the HRST into our processes as, providers and SCs. If anyone's willing and interested to coordinate with us on that, I had talked to Maren Haberly about developing a plan for this year as to how we could explore that further. And I know that we have definitely received some outreach from different providers with a lot of questions about HRST. And I'll pull another document up here if I can, but and I'm really not sure if this came with one of the previous webcasts, if this was actually an attachment to that last announcement that came out in January of 2021, but I find this is a good reference resource for me. I'm going to pull it up now. Okay, so this is a definition that came from PADHS of their perspective on roles and responsibilities for providers, for SCs, for AE, and for the HICUs. And I just find going back to this, to me, really helps put into perspective some of the things that we could be working on to better make use of the data, to better use this for risk management. If people don't have that, as I said, I'm not sure if it was attached to that last announcement or not. I can certainly share it with Patrick and Craig, and they could disseminate it if that's at all helpful. But to me, this is probably a guideline that we would follow in continuing development. So obviously with HRST, there's a compliance piece, ODP's expectations, there's local ability to use this data, make sense of it, and there's the need to work on better communication through the ISP process about how the information is used. As I said before, implementing anything new like this does take time and does take some time to roll out. One other aspect of this that I just wanted to bring up to you in case you weren't aware, as this is its own separate website data source, it's not easily electronically integrated into ISPs at this point. That certainly poses another workload issue. I do know that ODP is continuing work on rollout of enterprise case management, and I'm assuming most have heard of that, but if not, it will in the future be a new platform to replace HCSIS. It will be more integrated with other DHS program offices, and they're also obviously focusing on integrating any other data sources that they might have available, definitely HRST being one. So the feedback that I'm hearing verbally from ODP is that they are attempting to make some of those connections within ECM that are not easily available through HCSIS. HCSIS is over 15 years old, and they don't have a lot of ability to make changes to that platform.
I mean, this looks like this is a document from original rollout. Is that accurate?
This was, I believe it was issued at the same time as the January 2021 update to the HRST protocols and guidelines, and that would be an announcement, and I can certainly give that to you if you want to disseminate it.
Yeah, I think so. Yeah, I mean, I'll ask members here to weigh in, but it looks to me, speaking for myself, that it would be a useful tool. And when we were speaking about, some of my first reactions recently came from the role of the HICUs. So I don't think we have any of our HICU partners on the call today. If you're there and I missed that, let me know, and love you to weigh in. But it sounds like they may be taking a more active role, has been my impression, in terms of now that we're into more of a maintenance phase after initial implementation. Does that sound accurate? Maybe these things were always there, or is some of that evolving in the HICU role from your perspective?
Yeah, to my knowledge, and having conversations, Kipro is our assigned HICU, and having conversations with Kevin and Pam Lodge there, who is the lead for HRST. I would say they have more recently, they've always had a role in the mechanics of making sure that providers are represented accurately in there and that they have access that they need. So they're your technical resource for that. But more recently, I believe they've received some expectations from the state as to how to better coordinate. And from what they are sharing with me, it really is reflected here in the HICU column as to what they may be doing. I think there's at this point, starting with the AEs that are a part of their region, and they are starting to have conversations with us about what might be helpful in this rollout. And so, you know, obviously Kevin or Natalie or any other of the directors would have more information about what exactly they were charged with. I know they've helped us connect with Intellect Ability in a way that is more analysis-based, quality management-based. And we had Dina from Intellect Ability had offered us some time to work with us on local issues. And she had come to our last risk mitigation forum to present, and she really went through the screens of reports and all of the data that's housed in HRST, and I think gave us some great technical expertise.
So if you're here at our meeting today and you're having any experiences with HRST, again, some of the things I heard from members were some requirements that people felt were a bit onerous. And you indicated, Marion, I've heard this as well, directly and indirectly from ODP. I know they want to streamline the process. So we know they're very well aware of some of the issues. But if you have particular things you're experiencing, and then we will also see if we can follow up with the HICUs about any guidance that they want to give currently about what's going on or how this transition is working. But you know, again, at your meeting, if you're experiencing any concerns, we would love to hear from you so that you could kind of advise us what information we need to bridge the gap on. But while we wait for anybody to comment or raise a question, Marion, so some of the more recent announcements on HRST, and Craig, I don't know if you're able to post some of the information on, I know there were a couple of things, I think the most recent being a survey about linking existing data systems to the HRST. So I have not inquired about any feedback about, you know, that was just sort of an exploration the way it was described in the ODP announcement. Are you hearing anything from ODP, Marion, about what exactly that means, what they would be looking to do from that survey information?
No, and I actually, until you mentioned it, didn't realize that went out. I would imagine that they would be looking for examples of how providers could more easily use the data from that system, but I don't know that for sure.
Yeah, and we'll post it if Craig hasn't already. And it says linking existing data when enable select data fields to autofill with data from these data systems on a routine frequency, thus reducing the amount of duplicate data entry. So it sounds like just integrating things from existing systems and hopefully helping to inform the ISP and not creating a lot of additional steps. And again, that's probably more specific as to what I was hearing, just work involved to keep things updated. And obviously, if the information's out there somewhere, it would be great to just access it. But if there's new information that just has to constantly be reviewed, I know I've heard concerns about how to keep medications up to date most effectively rather than a manual entry process. So that's probably one example. You know, that's not going to be updated all the time unless it is manually updated, unless they can bridge that kind of gap. So, you know, if you completed the survey, have any comments about it, likewise, let us know. If there's anything that specifically they were asking for, you struggled to sort of come up with a good response. But, you know, we'll stay on top of this issue and continue to update members with any developments. And yeah, thanks for the overview there, Marion. And I'll probably, unless you have anything you want to wrap up with, or we have any questions, Craig?
No, and I will share this document that I pulled up with you.
Yes, please. Thanks, Angie, and perhaps others who provided us some input that, yes, useful. I'm guessing a lot of people haven't seen it before, or it's been a while. So we will get that out to everybody. And anything that you are comfortable sharing, Marion, from the slides or anything from your office that's helpful,
Sure.
We're glad to distribute that to members as well. So moving ahead, I will move on to the agenda. I'm guessing you can help us sort of sort through some of this too regarding the online vacancy management tool.
Right. If anyone has any questions, I'm more than happy to try to answer them. I felt that the guidance that went out was pretty clear to us, but I will mention that in that guidance, something that I would want you to make sure that you know and picked up from that is that the online vacancy management tool is available to everyone statewide. So once you are entering that information through the, I believe it's a Question Pro survey, but once you have forwarded that information along, it then is added to reports that are available statewide through my ODP. One thing that it's, it just may be a consideration for you is if you have a local vacancy and you really want to work locally to fill that before you would be adding it to that statewide list, you're certainly able to do that. There's no requirement or time frame to add it to the statewide vacancy management tool. So for example, if you wanted to reach out to some of the local SEOs to try to fill a vacancy, if you we do ask, I'll just speak for Allegheny, we do ask that you continue to inform our office of your vacancies, and with the objective that we know of persons in need a whole lot sooner than the turnaround time that it may take to get on a statewide list. So were there any questions about that I could try to answer?
We'll keep a watch for that. Well, I have one. So I'll start with, so I guess the initial reports and reviews where it sort of sounded underutilized at the early stages, but I guess vacancies have sort of accumulated over time. So maybe your knowledge and other AEs, the knowledge of the vacancies that are out there. Do you have an opinion on whether or not maybe it is being used as much or more than the previous process that was manual? It's just that there was kind of already an existing database that you already knew most of your vacancies to begin with, so you have something to compare to. Do you think it's an easier, more streamlined tool? And do you have a sense just on process, kind of separating it out maybe from the numbers it's generating right now?
Yeah, and I can't speak to the utilization. I thought someone in our office may have said that it was picking up speed. I don't know. I will say that we at the counties, again, I'll just speak for us, we kept as much closed tabs as we could on what vacancies were available that providers were willing to offer up. And it's still important to us locally, but I do think it makes sense to have that integrated statewide information available. We have so many people that are crossing counties that are looking for services that aren't available in their counties, that I do think it does make sense to have ODP take a more of a role in assembling that information for us. They tried that in the past and it was just too cumbersome, I guess, but I think they have a better process now.
So you mentioned some reporting that gets generated from the vacancy management tool. I see we have a question about, is there a way to verify that your agency has been added to the vacancy list once the form is submitted?
I feel like there was something that just recently came out about that, and I can certainly go back and look. You should be able to find it on my ODP, but I'm not sure what your screens look like and if they're different.
Greg, if you're able to, I'm thinking it might be in the announcement announcing the tool that there was going to be some periodic reporting coming from ODP once they were sort of fully up and running. So if it's there, we'll try to find it and reference it. But if there's anything additional, did you mention sort of multiple reporting, or would there sort of be just one central report? And I guess, is there something different for, say, approved program capacity management that you and ODP do? Is it, or are they trying to work from one database, one report?
I think for vacancies, because vacancies is more specific to what you have available that you would like to offer. It's not a survey back to providers to say, what do you look like as a provider and how much capacity do you have for other reasons? So really the vacancy is to make it all work for all of us. If you're looking for persons to reach out to talk to about vacancies, then that's really a win-win, hopefully.
Okay.
Yeah.
And Craig, what do you have there?
So that's just the information based on the question from the bulletin itself, or the announcement that the reports will be distributed to AEs and SEOs to make referrals. So you can see the report and download it directly from my ODP, and that link is there.
Okay, so I guess if you see what you reported, you would see it on the report, I guess, is the connection. You said that's right from the announcement that we posted, Craig?
Correct.
Okay, so that's there. Take a look. If you have follow-up questions or you've been using the tool and finding that that's not working, or I really don't know the answer. Are they issuing reports? Marianne, do you know?
Yeah, yes, the reports have started to be posted there, yes.
Okay, and Craig, then help me out. What is it saying? ODP distributes this report monthly through the listservs. So is that how you get them, Marianne, or is there?
So far, we have been pulling it down from my ODP. I
Okay.
haven't, yeah.
Okay, so then it's on my ODP, so everybody should be able to access it. I'm guessing it's the same report that's being sent out through the listeners. Okay, so we'll follow up and confirm that we're giving accurate information on that. Is that a link, Craig, you just added?
Sorry, yes, I'm on mute. Yes, it is the link that was directly from the bulletin, or
Okay.
the announcement, sorry.
Okay, so take a look, anybody that wants to confirm if you've been completing the tool. If you haven't been using the tool, we encourage you to use it. And you do have to update it as vacancies are filled. I believe that's the case, correct, Marianne?
It's not a requirement. Again, this is really a way to make things work more smoothly. So if you choose not to post a vacancy, there's no compliance issue involved with this particular process.
Okay.
So just as a follow-up, we will have to check on that. So if you do click on the link and go to my ODP, it does give you a message if you are not an AE or an SEO that says it's restricted to those users only. So we'll have to follow up and see if there's another way to get that information out to providers.
Okay, Craig, thanks for vetting that and making that clarification on the fly. So, all right, so there you have it. You apparently can't check unless you're AE SEO. So something else that we'll raise, and you know, I'll pose the question to ODP. I have a regular meeting coming up, with a list of items for follow-up. Anything that's relevant to our discussion here today, we will certainly push that out to members. So I think you've kind of covered the local vacancy management at county level, Marianne, and we had a conversation earlier in the week about Polk and Whitehaven transitions, and so that's also something else that you would be involved with directly. Probably more so for Polk for you, I'm guessing, but maybe not.
Right. No, absolutely. Polk is the majority of the folks that we would be working with. So, you know, honestly, I do not know what communications you as providers may have received about the state center transitions to date. So if I can really only speak from our end. We continue to do the planning. It was obviously delayed and affected for a while there by the pandemic. We are right in this very moment. We are working on meetings to share the information that's available on the folks that are at Polk that are interested to move out to the community. And so in Allegheny, we're having a meeting on the 19th. And that invitation went out to our entire provider contact list. So certainly you should have that. If you don't have that, Barb Byers would be the person to contact within our AE, but certainly also you could just send something to me if you don't have the link. It's a Zoom meeting on the 19th, next Tuesday. We would be going through all of the individuals with Allegheny County that might be interested in placement in moving to the community. I will say also, again, I don't know what ODP communicated, but if you go, actually, I'm going to pull this up if you don't mind. I would just want to show where this is on my ODP. Okay, so if you go to my ODP, and I believe I'm certain this is available to providers because this is their method of connecting with us. If you go to resources and then state center transitions, and that's the page that I'm on here.
Were you able to share?
Oh, sorry. Let me try again. How about now?
Yep, you're good.
Okay, Thank you. So if you go to resources and then state center transitions, and then this is the page that you land on and gives a little background information there. There are one-page support summaries here that are obviously redacted for people's privacy, but you can go county by county to see the one-page summaries. So I'll just go to Allegheny. And then you scroll down here and it shows which counties are involved with this process. And these are the Allegheny folks. So I believe, let me just check here. I think we have about 50.
Mary, does that include folks that have expressed an unwillingness for placement?
No, it only includes people that are willing, because persons do still have the choice of moving to a state center that would be remaining open at this point.
Okay. Are you seeing any movement onto this list from folks now that the state's announced that they will transition folks?
You mean additional people choosing to look for community services?
Yeah, rather than go to Selinsgrove or Evansburg is the state.
The majority, I believe, are choosing to look for community services.
Okay. Yeah. Well, that's good. And we've talked about that in other forums too. So if you have capacity, I'll remind everybody there is startup money available to bring folks out of Polk or Whitehaven. So to the extent being the time is limited, the closure date that they have announced for both facilities is November 30th. Families have received letters, and good to hear, Marion, that most people have opted to go into the community. But there is probably an opportunity to, if you have a plan. I think that ODP always begins with, they're open to any suggestion, but folks have to select a provider first. So I encourage you to get involved in that process.
Yes, and we're definitely looking for provider interest in helping us with this. So if you can't come to the meeting on Tuesday, please, just shoot us an email. We'd be glad to speak with you individually, and you can go into the MyODP page for any county and get the one-page summary of the folks that are interested.
Okay, anything you want to share now or after the fact, we'll get it out for anybody that may need to join a meeting or a link or anything like that.
Mm-hmm.
Just because I don't want to forget to talk about it, also your work group that you mentioned on the HRST. So certainly that's what this session is all about, to the extent we can really get providers involved in sitting down with AEs, SCOs, and many in our membership, many on the call today. So if you have an interest in that, please let us know, let Marion know directly. And we'll try to work with you and sort through some of the fixes forthcoming there and try to provide some guidance along the way with what we know ODP would certainly like to do and accomplish. So I think that kind of closes us out on online vacancy management. Again, we know that doesn't apply to everybody, it's for residential services, but as you experience things, good or bad, or you're not certain on where to look for certain information, let us know. We will try to guide you in the right direction. So the last agenda item that we had for today was really just some topics we had heard from members about intermittently. Nothing, I think, that rose really to a level of anything that we wanted to devote a significant amount of time to it, unless there were questions about it. So not an exhaustive list, certainly. And as well, if you have a particular issue that you came today wanting to hear about, whether you're a supports coordination organization, administrative entity, or a provider, let us know so we can kind of make note of it, have some discussion. We'll go through a couple of these things briefly.
Patrick, we do have a question from Karen. Karen, I'm going to let you speak. Karen, you're on.
I'm showing Karen as muted, Craig.
Oh, maybe it was an accidental hand raise.
Can we unmute or? Oh. I know we can't. So circle back, Karen, if you let us know with the note if you want to speak and are having any problems, or we can read out your question. Okay. So I'll let you keep an eye on that, Craig. And I will note that I added remote supports and assistive technology. And being that that's something that you and I work very closely on with ODP, Marion. So Marion chairs I'll get the name of your work group incorrect. So I'll see if you remember and hopefully not put you on the spot. There are long names. That's why we're asking.
We're changing our name. It's not really accurate anymore. We've evolved so much over the last couple of years, but I can give a brief summary of what we're doing if you like.
Yeah, if you would.
Okay.
And I know that Christina Rommel from Safe and Home was registered, and she was at your meeting this morning, and it was
Right.
always good to hear from her and listen in on some of the things that are going on. Certainly with them being a member here, and that's something we're also trying to work with them as part of the ODP Tech Task Force. Our work group being strategic partnerships and funding, so we'd really like to pursue a couple of different things. One with the University of Pittsburgh Human Engineering Resource Laboratories, which we've developed a connection there, and we'd also like to be working more actively in tech adoption for both remote supports and assistive technology through Safe and Home. So that's a little bit about what we're doing. Sorry for the interruption, got that out of the way. So you can talk about your work now.
No, I'll just mention that, so on the State Technology Task Force, I'm a chairperson of one of the subcommittees, and our group is working on, for this upcoming year, on a virtual roadshow. We have just, all of us on our group, and it's a very diverse group, have been connected with various people across the state who are implementing technology, who are doing really innovative and great things. And we think that our primary mission is to hopefully get people more exposure to what's going on, and also to help with people's comfort level. So if integrating technology into the services we deliver seems like a challenge, I think it does help to start with examples of how that's been done, especially from a person-centered perspective, what that meant to those persons. We have a couple providers who have volunteered to share their development on that roadshow, and we have some SCs who have volunteered also to share how they have worked on specific needs of people they support using technology. And then we have some folks who have connected with TechOwl and using their online tool, and so to reach out and get some more information about just assistive tech and communication options and various things like that. So we're hoping, our tentative date right now is to do that virtual roadshow in November. It may or may not be delayed because we are looking for some help in maybe some professional recording, so that we're not all, so that we're not trying to record ourselves on Zoom. We're hoping for some professional advice on that.
Yeah.
But I'll just proactively say, I'll be marketing for us. If anyone wants to host us, including you, Patrick, but if anyone wants to host that virtual roadshow, we're planning on 90 minutes, and we're hoping to reach out to groups that are already meeting, that already have, that looking for some of this information rather than just doing general meeting links.
Well, that's perfect timing, and you can mark us down. We'll talk more about that later. And I think that once, I should also mention, based on some of the comments you made about TechOwl, that sort of the other piece, we made a decision with the work group this year that we were kind of break down strategic partnerships and funding into sort of separate lanes. We sort of had been looking at just private sector funding as one big thing. So my co-chair is Susan Tackow from the Pennsylvania Assistive Technology Foundation, and they have a great resource manual. We started to put that out. I know through Andrea Layton's work on the marketing work group of Tech Task Force, she has a newsletter in draft, so we put that in the newsletter that's going to be going out. I'm sure you've provided some updates there as well. So that's all very great to get more information out there, but we hope to be pushing that out there as well to support tech adoption on resources that are available that we want to make folks aware of. And of course, what ODP is doing with the waivers, there are really a lot of opportunities, and we know that embedded in your res rates, for instance, is you can choose to do this, and I know there's a lot of different options, from remote supports, assistive technology, and some things that we want to continue to advance and promote. So we have traditionally done a tech summit in the fall, so that may work out very well, and we'll keep folks updated there as well on anything from Tech Task Force. And it does give me an opportunity to say that end of the month, I was in contact with Kristen over the last couple of weeks, and we spoke this morning, and we are going to have Jeremy, Yale, Lauren House come out in person to our July 29th meeting at the Regional Learning Alliance. And of course, we will do either a Zoom or a stream so that there's remote access for that meeting. But this is only the second time this year that we are going to do a live in-person meeting. Kristen Ahrens is likewise going to join us at that meeting. So we had planned a lunch and some breakout sessions after Kristen. So I just said it out loud, so I guess it's going to happen now. So you can look for that. We have a program forthcoming, and so we're happy to bring that back. We're not sure expectations. Things have been a little slow, and it's summer months, but we're happy to have Kristen come out. We're very grateful for both her presence and bringing out a lot of key staff. So we're also expecting Dr. Cherpis to come out, talk about Fatal 4 and some things around HRST. I know we're going to have a session with Julie Michon and the waivers, and Rick Smith is going to be joining in person too. So I think I hit everybody, but that's the plan. We'll probably open our registration for the meeting a little earlier than we usually do, but this is on the calendar already as the July 29th monthly membership meeting. But we are going to be doing it a little bit more as a TPA conference also. So with Jeremy and with Lauren there, who, as Marion certainly knows, and maybe many others, they co-chair Tech Task Force. We have monthly meetings with them. Deloitte Consulting is now involved to sort of help us out, guiding things, developing project management tools, so we can better implement some things on tech sort of at the ODP level as far as the task force and the work groups are concerned. But so there's a little bit of news. You can look for the announcement, and we'll keep everybody informed as things develop there or of any changes. But thought I would mention that there as well. So anything more on any of these subjects that you want to weigh in on, Marion? So again, I don't have anything really as additional guidance. I think we've probably touched upon incident management a little bit here as it relates to maybe systems design, HRST. I haven't gotten into the public health emergency declarations. I did sort of want to get some feedback from everybody as far as optimum role for TPA. Just, does this type of meeting work for you? To the extent we're trying to bridge gaps with guidance as it's coming from ODP and how we coordinate together throughout membership, both from administrative entities, provider supports coordination, HICUs. So we have all of you in our membership, and we have a lot of supportive organizations as associates. So, please weigh in to let us know where this can be most meaningful and useful for you to bridge some of these gaps. I certainly learned a few things along the way in the last hour, so hopefully you have too, but if you have not, we're missing anything that you need to know or the process you think can be improved. We're just interested in hearing from you on that. So with that, we'll look for any final questions here coming in. Again, encourage you to raise any issues we have not talked about so far today, to the extent it involves any sort of guidance issues or conflicts or uncertainty that you may have. And Marion and or Craig, I'll go back to you. Anything on the list here that you want to report on or ask a question about?
No, I would just say if there are other AEs and SES on the line, if there's anything related to anything I said that you wanted to weigh in on, or other things that are priorities on your end, I certainly am not meant to be representing everyone. I'm just the person on camera.
And definitely thanks for doing that. And of course, anybody is welcome to join the panel. I think we typically do a call out for issues and for people who would like to be panelists. And that invitation is always open for any of our work groups, and particularly this meeting that, we specifically call it a roundtable because we like to try to generate as much discussion as we can. We acknowledge difficult to do in a Zoom format all the time, but we appreciate any input and feedback that you can give us and any participation in any way that you want, that you're comfortable with during the meeting. So, with that, I'll just do a final call with any last questions. If there's anything out there, Craig, let me turn to you. Is there anything that I've missed that's out there for many members?
Not right now.
Okay, so with that, I'm going to give you 10 minutes back to your day, which I'm sure you can use. I want to thank everybody for being here today. And there you have it. I'll remind you our July 29th meeting. Craig and I will be talking a little bit later this week, see how early we can push out the conference brochure. There'll be several breakout sessions that I was kind of covering a little bit, but we'll have a broad sort of array of ODP topics, policy issues, presenters from ODP, maybe a few other things thrown in. So it'll be good to have Kristen come out in person. Again, if you can't make it in person, we know we've got members from all across the state. We will definitely be having a remote opportunity that you can participate in the meeting remotely. But Have a great day, everyone. Thanks for your time today. Thank you, Marion, for joining us. And we'll talk to everyone soon. Thank you.